Thank you for staying tuned to Channels Television. A warm welcome to Health Matters. I'm Yomi Otaigbe. Today on the program, our spotlight beams on Nigeria's health system and its workforce. It's no longer news that the country's healthcare delivery system is struggling with inadequate manpower to deliver the much-needed services to the people. This is an existential threat to Nigeria's healthcare system. We hear and have seen facilities operating on skeletal staff strength, overburdened nurses managing double their patient load, and of specialized departments struggling to function because the expertise they need has left our shores. The statistics are sobering, but the reality for the average Nigerian family is far more deep-seated. We are asking, why are our hospitals increasingly empty of the very people who keep them running, despite our training capacity? These and other questions will be answered by my guests after this short break. Do stay with us. Welcome back. The World Health Organization, WHO, estimates that by the year 2030, there will be a global shortage of over 10 million health workers, with the most severe deficits in low and middle income countries like Nigeria. This projected shortfall directly threatens the realization of Sustainable Development Goals 3, ensuring healthy lives and promoting well-being for all. According to the State of Health of the Nation Report 2024, put together by the Federal Ministry of Health and Social Welfare, most skilled health workers are concentrated in urban centers such as Lagos, Abuja, and southern states, while rural areas and much of the northern region remain underserved. This imbalance leads to critical care gaps and physician burnout. Annual graduation rates of 4,399 doctors and 274 dentists in 2024 remain insufficient. The doctor-to-patient ratio stands at just 2.9 per 10,000, which is about one doctor per 3,474 people. And this is far below the WHO recommendation of 17 per 10,000. With a population exceeding 230 million, Nigeria needs nearly 400,000 doctors to meet international standards. To tell us more about the current state of affairs in Nigeria's health system, I'm now being joined by the chairman of the Nigerian Medical Association Lagos State Chapter, who is also a consultant trauma and orthopedic surgeon, Dr. Said Babajide. Thank you so much for joining us today on the program.
Yeah, thank you very much, the viewer and everybody.
Okay, you are in the system, so you would know, better. We have just about 2.9, doctors to 10,000. That's like about 3 doctors to 10,000. What is the state of, if we take it from the medical practitioners, what's the figure that we have currently in terms of those that are registered and actively working in the country?
Yeah, thank you very much. In terms of those that are registered from the MDCN, you have about 5 million doctors registered with the MDCN, and that 5 million doctors are the one registered in Nigeria. Some also abroad, they're also registering just to continue the practice, and now you have about 5 million. In Lagos, you have about 8 million doctors as of now. Now, from that,
Sorry, 5 million registered nationally.
55 million.
55 million.
55 million registered nationally. We have about 8 million registered
in Lagos.
In Lagos, which is the highest among the other states. And from that, what is the population of Nigeria? People think about we have about 200 million population. If you now compare this with the 45 million people, you see it is not comparable. Therefore, in Nigeria as now, you have, like you said, you have the ratio of 2.9
about
to
3 doctors to 10,000 patients.
to 10,000, 3 doctors to 10,000. And when you now come by 1 doctor to 3,000 patients, therefore, that ratio is very wide, and it continue to be wider because of the where people are leaving the country because of the brain drain and what we call Japa syndrome. And from that, what will happen? It will affect the health system, and also the Nigeria is also losing in the sense that to train a doctor, it takes about $21. That means that about 29 million naira.
$21,000, you mean?
Yeah, $21,000.
Okay.
To train a doctor, which estimate to about 29 million naira to train a doctor. And for you to train a doctor with such an amount of money, and that doctor goes outside, it's a big loss to the nation. And what really caused all this thing is in terms of Japa, why people are living. We call something what we call push and pull. Push means that what make people to go, and pull is what attracts from the other from other country for Nigeria doctor to train Nigeria doctor to go. Now, what are the causes of this push? Number one is what we call in terms of remuneration, insurance, and in terms of remuneration, what I mean in terms of remuneration is that how much doctor in Nigeria are being paid is below what everybody can. Let's say the lowest pay in Nigeria is about 300,000, estimate about $214. You have to take this in dollars.
Why are you putting it in dollars?
Yeah, why I'm putting it.
Since we are spending naira in Nigeria.
Yes, the reason is that me, in Nigeria, I believe in naira. I always say that government should talk about nairalization, not dollarization. But for people to understand, because people feel that doctors are the highest paid, and because when you say you are being paid 300,000, people say, why?
But certainly doctors are amongst the highest paid in the country, right?
Yes, we are.
When you compare with some other professions.
Yes, we are the highest paid. But what about the input? People look at input. What input does doctor give comparing to? Due respect to any other profession, what input? In the input is there that you don't have your life. You can be called at any point in time. You don't have weekend. You don't have any. After doing your normal daily work of Monday to Friday, you see what you do call. Those are the people should look at what is input we are giving. Do you have the time for any extra work that any extra means to now when I now go to I'm also talking about the amount people doctor are getting in abroad. In UK, they are being paid about 4 million per month. In Nigeria, they are paid 300,000 per month.
That is 4 million naira.
4 million, yes. When I convert, because you say I should not be talking about dollar again.
Okay.
That is 4 million.
But of course, we have different things like parameters. Okay, you live in Nigeria. Yeah. The things that you can buy for certain amounts is not the same you buy it when you're abroad. But you're just trying to. I'm
just trying to make it clear. Even we know in Nigeria, some part of Lagos is very expensive. That I want to make it clear for people. And why I'm saying it that. I think I've been practicing for almost 30 years now. The amount I'm collecting as officer or medical officer in terms of dollar is higher than what I'm collecting as a grade level 17 consultant now. When you look at in terms of dollar, because government do all this because of inflation. Now, what the government should do, increase the remuneration of doctor according to the inflation. If you increase remuneration, inflation increase, at the end of the day, you are not getting what you're supposed to get. The second one which we want the government to do, if you reduce this asking for more, is not taxable call duty. When President Tinubu was governor of Lagos State, he did it. Our call duty were not taxed. Our call duty were not taxed. Because our call duty is about 40% of our gross. If you don't tax it, demand for more money will reduce. That means that the call, because in the new law of the taxation and the previous one, some allowances were not taxed. We are saying put those our allowances or health worker allowances are not taxable. That means that take home will be higher comparing to the gross. And again, problem we have, while you are talking about that tax, doctor, health worker are the most taxed worker in Nigeria. Paying tax of 200 something thousand, almost 300,000 as a tax. You are not a brewery, you are not even, you are not in the industry. Therefore, what government should also do to do that. The other thing the government should do is in terms of infrastructural development. They should provide infrastructure, equipment that will be able to use. You cannot work in a situation where when you need something to do, you don't have, it's not available. There are a lot of development we are moving away from in surgery now, moving from open surgery to laparoscopy surgery. People are not going to robotic surgery. You don't have it. In Nigeria, we have robotic neurologists, about 3 or 4 robotic neurology in Nigeria. That's what we are saying. Give all the equipment should also be available. Also, in terms of condition of environmental condition where you are working. Now, when people work in Nigeria, doctors are burnt out doing 72 call duty. By the time you're on call, I can tell you, if you look at the roster of some house officer, they be on call to you all month. We just lost a doctor in Alimosho yesterday because of this burnout issue. And that's why I'm saying that get more doctor. When you get more doctor, that stress will reduce. And in an environment when you are the only one working, people, the young doctor, they don't have time for that. They will go. Even some of them are even leaving the public, they are going to private. Even I can tell you, some doctors are even not working at all. After finishing, they go into music, into any other thing. Now, the other thing the government should also look into in terms of insurance, health insurance that cover them. Indemnity insurance, because what you are working, no indemnity insurance, no insurance to anybody. If you die, you just die on your own. The work continue. Those are the things government should do to improve, attract doctor to say. And also the one very important issue of welfare package. Government can do it. It's a very simple thing. That's the most one that can retain doctor in Nigeria. Just 2 things. Number one is getting housing loan with mortgage concept, in which case indirectly you are telling the doctor or the health worker to say, if you have a mortgage of, let's say, 15 years, 10 years, that means that they are not going to go anywhere, because especially in Lagos, if you have a house, half of your problem have been solved because you have where you stay. Therefore, if government can make the mortgage lesser rate, because it's high, even how many doctors can be able to avoid that? If I can tell you that now, doctors are finding it difficult to pay rent. They cannot, doctor, as I'm talking about, they cannot get rent. They cannot avoid rent in Surulere. Even though let me talk about it also, I think about via rent in Surulere. Even within Kenya, they cannot avoid. Where they go inside, even outside Lagos, going towards the Ibadan expressway. Now, two, what even more painful is that doctor cannot pay the school fees of their children at once. They have to pay. I've seen doctor that came to my office with his wife. They told me that they told them that by the next Monday, don't bring your child if you cannot pay. I cry. It's very, very painful that after finishing many years, you cannot even pay simple, you cannot pay school fees. Now that was it. If you have that housing loan, and you are living in a comfortable house, and you know this is your house, and again you are not going to go because you are already born with 10 or 15 years. The second one is car loan. You are not saying they should give us car loan at a very low rate, in which case, even we have Nigeria made card now, which government can also do for us. What we're able to do, I'm just saying that what we're able to do is that if you have a car in Lagos, you have a house, what's the other problem? Any other thing?
Okay, I know that migration is everyone's right, and you know, some of these challenges that you have, you know, enumerated, you can find in some other professions too. Maybe not, you know, as spelled out as it is for the doctors or those health workers. But where do we draw the line of being patriotic and saying, okay, the nation has spent so much. You mentioned earlier about 29 million to train a doctor. And I think some time ago there was the discussion around, even though of course it didn't scale through, that maybe doctors should be made to sign. You remember?
I remember by the Ngigi,
How do
Dr.
you
Ngigi.
think, apart from the fact that okay, all of these issues are there, that the doctors or medical workers can also look back and say, okay, like some other professions are doing, and say, this is our country, what do we do differently so that we can help out?
Thank you.
While the doctors, the government will be looking into some of these things you raised.
Now, you use the word patriotism. If doctors are not patriotic, they cannot be staying in Nigeria. Everybody will leave. Because of the passion to treat Nigeria, passion to care for Nigeria, that we are saying. Some of us are saying because of Nigeria. We don't want to go to any other place. But if you are not patriotic, you have left. And you talk about other, and with due respect to other professions, everybody have made the condition for them to leave the country. Some may have condition because of the economic situation. Some may have because of the family issue. Some may have because of any other thing. But majority, let me say, 80% or 90% of why doctors are leaving is because of economic problem and bad condition of environment. That is, I can tell you that one, because you can compare, but when you look at it, even the ratio of why doctors are leaving, even more than, even you see the nurses are even taking over the doctor now in terms of leaving this. Now, patriotism, that's why we are here. Because of patriotism, we give all our life, all our body, even we donate blood. Even let me also tell you, we pay for patient care. From our money, we pay patient. Patient cannot be able to afford it. We pay for it from our money. What patriotism do you want us to do? Okay,
let me quickly show you 5 pillars which I saw in that State of the Nation health reports that the Federal Ministry of Health put up to. They are also, I think, thinking about improved working conditions in terms of facility upgrade, safety protocols, salary and benefits, capacity building, managed migration. That is, okay, you can go, but maybe go learn more and come back to the country, you understand? And then incentives for rural areas. Rural areas, you know, they are even the areas that maybe we should also put more attention in terms of why don't doctors, at least the ones that are still here, don't want to go to rural areas?
Now, let me talk about the security you talk about. It's part of the thing where people are, the young doctors are living. We have a poor security. We have the local security problem, insecurity problem. We also a Nigeria insecurity problem. The local insecurity problem is that doctors are being harassed. Someone will come to hospital with gun, slap doctor, beat doctors, beat health worker. Look at what happened recently at your teaching hospital. Until when the EFCC went to harass doctor, until when the enemy now took it up. That is not the. It still continue. That's why enemy Lagos had the what do you call it rally for stoppage of harassment of doctor, especially by the law enforcement agents, particularly the police. Because you have to, they just go there and arrest doctor. Now, the other thing is in terms of security you are talking about is that the other
talking about the rural areas.
The rural area. Now, doctor want to work anywhere. Incentives. Now, if I work in the rural area, I don't get water. There are no good school for my children to go. I cannot have car. There are no car there. I've been paid poorly. Look at the rural allowance. How much is the rural allowance compared to the amount? Rural allowance is very minute a part of it. Increase rural allowance, improve the rural area. Doctor can work anywhere. It's the government that are going to do that. Provide the good roads, provide better infrastructure. Doctor can work. That's why I'm talking about issue of primary health care. That's where issue of primary health care should come in. If you want to have a good rural health care delivery, primary health care should have to take.
It's very key.
Key.
Thank you so much, Doctor, for coming. I wish we had more time, to talk about this. And we're just talking today about, the medical practitioners. We have the nurses, the lab scientists. It's a whole gamut of all of the health workers, in the health system. But thank you indeed. The chairman, Nigeria Medical Association, Lagos State Chapter, and consultant trauma and orthopedic surgeon, Dr. Sahid Babajide. Thank you.
Thank you, Nigeria.
And we still have some time to get to our news corner to tell you about the latest stories.
The Nigeria Center for Disease Control and Prevention is rejecting a proposed National Institute for Public Health and Infectious Diseases establishment bill currently being considered in the House of Representatives. The agency's position was made known by the Director General of the agency during a public hearing organized by the House Committee on Infectious Diseases. He warns that creating a parallel public health institution would duplicate its statutory responsibilities and urged the National Assembly to strengthen existing public health structures instead.
Public health emergencies require a single, clearly recognized national authority. Establishing another federal institution with overlapping responsibilities will create uncertainty regarding leadership, accountability, and operational command during outbreaks and health emergencies. Questions will inevitably arise regarding which institutions lead surveillance, coordinates response activities, and manages laboratory networks or serves as Nigeria's official public authority.
Stakeholders from the health system, regulatory bodies, and religious organizations are sounding the alarm over what they describe as a growing drug abuse pandemic in Nigeria, warning that addiction is increasingly affecting young people and threatening the health, productivity, and future of the nation. At a drug awareness and recovery campaign in Abuja, participants stressed the importance of prevention, treatment, and sustained public enlightenment, especially among young people, adding that the fight against drug abuse requires a whole-of-society approach involving government institutions, schools, religious organizations, families, and communities.
The campaign is timely because of the youth's involvement in drugs. The rate is very alarming. That is why NDLA cannot do it alone. We need NGOs like ASDAC Center of Hope Foundation to help NDLA to assist us in this war against drug abuse.
To come up with an AI tool that is free and it's a do-it-yourself addiction screening, brief intervention, and referral system, in which you could screen for substance addiction, you could screen for behavioral addiction, you could screen for your triggers.
Finally, on the news segment, the World Health Organization, WHO, has called on countries to expand newborn screening for birth defects, highlighting how early detection and treatment can save lives and reduce lifelong disability for millions of children. In a new report by the organization titled Strengthening Capacity for Newborn Screening, Diagnosis and Management of Birth Defects, the WHO identifies newborn screening as an important opportunity to accelerate progress in child survival. Some of the birth defects include congenital hypothyroidism, sickle cell disease, hearing impairment, and some metabolic disorders. Worldwide, an estimated 8 million babies are born with a birth defect each year, and birth defects now account for almost 8% of all deaths among children under 5. WHO is urging governments to integrate newborn screening, diagnosis, and treatment into routine health services and universal health coverage programs, beginning with conditions that are country priorities and that can be effectively detected and feasibly managed with their health system.
That's how we wrap up Health Matters for this week. Thank you so much for being with us on the program. I'll see you again next week. I am Yomi Otaigwe. Bye for now.